This is Cable Channel 5, your local origination station serving the greater hub area.
Good evening and welcome to another edition of the Yuba Sutter Medical Explorer. My name is Dr. Robert Peppercorn and my specialty is dermatology. I serve as host of this program. The purpose of the Medical Explorer is to explore the medical communities of Yuba and Sutter counties and to take you behind the scenes of medical care practices in our local area. We have a very interesting program for you tonight as we explore the dental specialty that deals with preserving your gums and teeth so that we can avoid dentures and have sparkling smiles for a lifetime. This is the field of periodontics. Our Channel 5 cameras will take us into the offices of one of our area's most popular periodontists, and we will watch him counsel patients on proper dental hygiene. It's a very interesting and very important subject, and I hope that you will stay with us for the next half hour. Before getting to our topic tonight, though, let's take a look at the latest medical news. A new fast and reliable test has been developed to detect birth defects very early in pregnancy. The test is called a chorion biopsy. The test is similar to amniocentesis, which is now the standard prenatal test for genetic defects. However, the new test can be used as early as the 7th week of pregnancy, while the current test can't be done until the 16th week. The results are available overnight, compared with up to 4 weeks for amniocentesis. The chorion biopsy is painless, takes about 30 minutes, and costs about $800. The more complicated amniocentesis also costs about $800. The health risks of the test are believed to be about the same as amniocentesis. The Michael Reese Hospital and Medical Center in Chicago is the first United States facility to use the new method which was developed in Europe. In a chorion biopsy, a catheter takes a tiny tissue sample from the uterus. Chromosomes are analyzed to spot birth defects. Amniocentesis uses a needle inserted through the abdomen to take a sample of fluid surrounding the developing fetus. Chromosome analysis is done after cells are cultured and allowed to grow. In place of my health tips tonight, several of my medical colleagues have asked me to repeat an editorial that I presented several months ago on the subject of medical advertising. Here are some of my personal comments. Recently, many of our watchers have noticed that several local physicians have begun a massive advertising campaign to promote their offices. For many years, doctors and their professional organizations attempted to discourage medical advertising. This was done to prevent patients from picking their doctors solely because of a well-written promotional announcement in newspapers, on radio, or on television. Recently, the federal government has stated that doctors may not be prohibited from advertising. Since we are likely to see more of this in the media, I feel that I must warn the community to not choose their physicians only because of a nicely produced commercial on TV or radio. Before choosing a doctor, I urge you to discuss recommendations with your friends and relatives. If this is not possible, then you should consider calling the Yuba Sutter Colusa County Medical Society for their lists of doctors and their professional qualifications. If you're seeking a new medical specialist, you should consider asking him about his training and whether he is board eligible or board certified. Please don't be misled by fancy, colorful advertisements. Don't pick your doctor just because you like the sound of his commercial on the radio or because he had a pretty advertisement in the newspaper. Remember to ask about very much more important factors. Now, on with the Medical Explorer. Have you ever thought about the annoying possibility of losing your teeth? Do you know if you're doing the right things to keep your teeth healthy for your whole life? Let's travel over to Yuba City and visit the office of two of our area's most popular periodontists. I'm standing now in the offices of Dr. Rick Cole and Dr. Gary Bogle, periodontists in Yuba City. With me now is Dr. Cole. Dr. Cole, what are we going to see today?
Today we're going to be observing an examination of a patient, and later we'll be staining the mouth to observe plaque formation.
Great. Can you show us on the model exactly where we'll be looking at the patient?
Certainly. Today we'll be probing the gum tissue to detect bone loss around the periphery of the teeth.
This little instrument here is one of the instruments used during the exam? Is that
yes, this is a calibrated probe, and this is calibrated in 3, 6, 9 millimeters increments. And normally the crevice between the tooth and the gum should be approximately 3 to 4 millimeters. If it's deeper than this, then we know we have some signs, initial signs of periodontal disease.
So this is just one of the tools that you use to see how much damage there is already at the gum?
Certainly, yes. Bob, let me introduce Dr. Gary Bogle to you. He'll be performing a periodontal examination today.
Great. Well, let's go ahead, Dr. Bogle.
The first thing we do, our primary concern is finding out what kind of attachment loss we've had around teeth. Periodontal disease basically is bone loss. And what we do to determine clinically what's happened as far as bone loss goes is we use a little probe called a periodontal probe. It's calibrated in 3 millimeter increments. We set it next to a tooth surface, let it slide down between the gum and the tooth, and we can tell just exactly where the bone level is around each tooth surface that way. You may not be able to see the details all that great. We go in about 3 millimeters here, which tells us that even though the gum level's here around this tooth, the bone level in actuality is about 3 millimeters below that at approximately this level. So that tells us we have a space between the gum and the tooth down to the bone level of 3 millimeters, that magnitude. And without measuring clinically pocket depth and bone loss with a periodontal probe, there isn't any way of knowing clinically just what kind of problems we have periodontally. Because when you look at that area, it looks like that should be attached to the tooth at this point where the gum is. In reality, the bone level's 3 millimeters below that.
I see. Would you tell us a little more about what actually causes the damage?
Bacteria collect on tooth surfaces, and by the way, 3 millimeters is within an acceptable normal range. What causes periodontal disease is bacteria, and bacteria clinically look just like tooth surfaces. They're the same color. It's very difficult to distinguish until you take a little object, run it over the tooth surface, and we get off, I don't know whether that shows up again in the camera or not, some white filmy material that looks like that. We call it plaque. It's primarily bacteria. Bacteria collect on tooth surfaces. They produce metabolic products which cause a simple inflammatory response in the gum tissue. That response in the gum tissue causes bone to disappear. And that's the cause of periodontal disease.
I see. So by removing that bacteria is how we try to prevent the gum disease, is that correct?
Right. On a daily basis, people have to do a perfect job of removing bacteria from each tooth surface. Then periodontal disease is prevented. And the vast majority of tooth loss in adults is caused by bone loss.
As you're inserting that probe, did you feel any pain?
Oh, no.
So it's basically a painless examination.
Oh, yes.
What else goes on during the periodontal exam?
Primarily, the dentist or the periodontist should go around each tooth surface like that, measuring bone loss, pocket depth. We also note any color changes. One of the earliest signs of periodontal disease is redness or bleeding of the gum tissue. Those kinds of things are noted. We take a look at how teeth hit together and what kind of forces are placed on teeth, because that can help us determine how stable they're going to be and what kind of procedures should actually be performed in order to stabilize things at that level too.
Great. Dr. Bogle, could you show us the proper way to clean and take care of the teeth?
I could, but there's somebody in our practice who does a better job of that than I do. Her name is Kim Shannon, and she can show you now.
Well, let's go over and watch Kim.
Okay.
Okay, hi.
Hi, Kim.
What I have done here is I've had Gloria stain her mouth with a disclosing solution. This way the patient can see the plaque that's accumulated on the tooth surface. Normally...
This is a chemical that actually shows where the bacteria and plaque are on the teeth?
Right. So as we look over at Gloria, smile first, Gloria. Okay. As you can see, the teeth, right in these areas, this is where the plaque accumulates on the teeth. Okay?
So that dark pinkish material is the actual plaque.
Right.
And that's bacterial products and pieces of actually bacteria, hundreds of thousands of bacteria on the teeth.
Right. And in order to clean the teeth properly, you have to brush and floss these areas.
Now, why don't you show us the proper way to floss now?
Okay, first I'll begin with flossing. The most important thing when flossing, as I'm going to show here, you want to get the floss in between the teeth, making sure that the floss is down into that 2 to 3 millimeters worth of gum tissue. Okay, this is where the plaque kind of accumulates and we don't clean properly. Like so.
And what does it mean when, as you're doing that, we might see some bleeding going on?
Okay, a little bit of bleeding can be caused by, one, irritation from the floss. If a person hasn't flossed before, their gums are inflamed and a little infected, and they'll probably go through a period of tenderness from new brushing and flossing techniques.
Should they floss between every tooth they can get between?
Each and every tooth individually.
How long does it usually take for an average person to do that?
Anywhere to 10, 15 minutes. There's not really a time. You know,
But it's not something they can do in 30 seconds.
No. Okay, when you're first learning, actually, it's difficult because these are new techniques, you know, and most people are not used to flossing at all, so it's difficult.
Now, we've learned that flossing is the most important thing to do, but we still need to use a brush as well.
Right, and demonstrating the brushing. Again, the important phase for periodontal disease is getting into the gum tissue. Okay, so for brushing, if I show on the bottom, you want to direct the bristles into the gum tissue, okay? And you want to use a friction, a jiggling action. The friction is what actually cleans the sticky plaque from the tooth surface. If I show on uppers, again, you're directing the bristles into the gum line.
Now, I remember when I was in elementary school, we used to get lectures that keep doing that.
Okay.
We used to get lectures that you should always brush down away from the gum, but that's not what you're doing.
No, in elementary school, you're basically concerned with cleaning the tooth surface. You know, cavity-prone years, you want to use a good fluoride toothpaste to coat and protect the tooth surface. But periodontal disease, we are directing everything or focusing towards the gum tissue, cleaning all areas of gum tissue around each tooth surface.
Should we use a hard or a soft brush?
We recommend soft bristle brushes.
Is it possibly to actually damage the gums by using too hard of a brush?
Right. As I mentioned before, you'd go through a really tender time with new brushing techniques, and anything too hard could cause traumatic problems on the gum tissue.
Thank you very much for taking the time to demonstrate this for us.
Thank you.
And thanks for being our patient today.
Oh, you're welcome.
Dr. Cole and Dr. Bogle did a fantastic job this evening demonstrating a periodontal exam and teaching us about the proper ways to care for our teeth and gums. Let's meet again with Dr. Rick Cole and discuss more about periodontal disease. Dr. Cole, welcome to the Medical Explorer, and thank you for being my guest this evening.
I'm glad to be here.
Thank you. I'd like to begin, and I always like to begin, by having my guests tell us about their educational background and training. Where did you go to school?
I received my dental degree at Loma Linda University in Southern California, after which I practiced in general dentistry at San Bernardino. Then I received my graduate training at Loma Linda University in periodontics and graduated in 1978.
Well, let's review for some of our viewers who are thinking of going into dentistry how many years all of this training takes. You have to go to college first, is that right?
Yes.
Where did you go to college?
Northeastern State University in Oklahoma.
From there to California.
Yes.
Interesting transition. So 4 years of college, then dental school, which is now 4 years as well?
Yes.
And then if you choose to go into a subspecialty such as periodontics, that's an additional how many years?
24 to 36 months.
And that's what you did, besides
Yes.
your work in research and your private practice work as well.
Yes.
Quite a long period of time. What is meant by the specialty of periodontics? What does that encompass?
The specialty of periodontics deals with the infections and diseases of the gum tissue and the bone surrounding the teeth.
So cavity would not be periodontics?
No, no.
So we're dealing with what's around the teeth then?
Yes.
I see. Can any dentist just put up a sign saying he's a periodontist?
No, periodontal training requires an additional 24 to 36 months of graduate training in an approved program.
How many approximately periodontists are there in our area?
There's 3 periodontists in the Yuba City, Marysville area.
And how many are here full-time?
Just me.
Just you? Well, that's very good. I'm glad you're here. What's meant by periodontal disease specifically? What is actually going on?
A periodontal disease is an infection that's related to bacterial deposits or plaque that accumulates around the gum line, and it's strictly an infection that involves the gum tissue and the surrounding bone.
I was just thinking that when I see a patient with an infection on their skin, I can just give them pills for a week and kill the infection. We can't do that with periodontal disease, can we?
No, periodontal disease is a chronic inflammation. The bacteria are always in the mouth, and they must be removed daily.
I see. Which is what we saw in the film from your office today.
Yes.
I see. When I look in the mirror and look at my gums, I often wonder what I can look for to see if there's any disease going on. Are there signs that we can look for at home to see if something's happening to our gums?
Certainly, and probably the hallmark sign of beginning periodontal disease is bleeding. Following that, you might look for foul odor or bad breath, loosening of the teeth in particular. If you press on the gums, if you notice pus expel between the gums, absolutely you have some severe problems.
So when someone has bad breath, does that always mean they have periodontal disease?
Not necessarily, but if it's a chronic problem, it's certainly a good
Something should be checked out.
Yes.
I see. Now, I notice once in a while when I use dental floss, I'll get some bleeding. Does that mean I'm having trouble with disease?
Probably you at least have some initial stages of periodontal
Uh-oh. Let's get a
infection.
mirror. I want to check this out right now. How do we make an appointment to see you? We just call up your office? Is that all there is to it?
That's adequate, yes.
Oh, okay. Let me check that out right away. How common is this gum disease?
Periodontal disease is the most prevalent disease known to man at present, and about 90% of the adult population has periodontal disease, and approximately 85% of teenagers. And it's responsible for about 70% of tooth loss in adults.
Well, I shouldn't feel alone if something's happening
Absolutely
to me.
not.
Well, that's a little bit more, well, I'm not sure it's more comforting, but what can I say? Why is flossing of the teeth always stressed by dentists and periodontists like yourself?
Because it's extremely important to remove bacterial deposits from between the teeth, and it's the only method currently that we have of removing bacterial deposits between the teeth.
So just taking a toothbrush and brushing in there really doesn't get into the
No, it will not clean between